Okay, we're going to go through the CPT, integumentary, and breast section. So here's just a real quick definition of integument. The membrane of the body, it includes, in addition to the epidermis and dermis, all your hair, nails, pseudoryphorus, your sweat glands, your sebaceous glands, your mammary glands. And the integumentary system involves a significant proportion of invasive procedures that are performed in a physician's office as well as a hospital outpatient setting. If the procedure extends beyond those boundaries, such as those involving the deep fascia, the muscle, the tendons, the nerves, the blood vessels, or other structures, the coder should refer to the other sections of the CPT book, such as that musculoskeletal section. So with incision and drainage, CPT doesn't really differentiate between simple and complicated, which can be very complicating to a coder when you're trying to define and decide, is it simple or is it complex? Complicated cases may involve the use of drains or packing, while simple incision and drainage is more to the abscess itself. And what if documentation extended beyond the superficial integumentary layers? Deep incision and drainage procedures that are found in the musculoskeletal system by anatomical location, like we talked about in our previous slide. An example would be an incision and drainage, or IND, of the shoulder area. That's deep abscess or hematoma. The coder would be directed to the musculoskeletal system of the shoulder area 2303. Now, debridement is considered a separate procedure only when the gross contamination requires prolonged cleansing, has appreciable amounts of devitalized or contaminated tissue and they're removed, or when that debridement is carried out separately. And a certain amount of debridement is typically included in wound laceration repair services, particularly if the wound edges, they're not clean and they won't lie close together, affording that neat suture line to give it a good healing cosmetic outcome. The physician may document that wound edges were clean, debrided, and then closed with suture, but this type of debridement would be considered included with that wound closure, and it would not be considered like an additional procedure that the coder would code. The physician would really, again, have to document that it was contaminated, prolonged cleansing, these other guidelines to be able to document it separately. Debridement with fractures and or dislocations, both open and closed wounds may require debridement that is beyond what is represented by the debridement codes, and most debridements are included with fractures, again, unless it's documented extensive. There are separate codes in the medicine chapter of CPT for debridement services performed by non-physician personnel. These codes are considered active wound care management services and are typically performed in wound care centers by physical therapists or other non-physician healthcare providers, although physicians can perform them. The codes 95797 and 95798 are selective, 97602 are non-selective, and they're differentiated by whether the debridement was selective, which is a high pressure water jet, sharp selective debridement with scissors, scalpel, or forceps, or non-selective, including wet to moist dressings, abrasion techniques. If non-selective wound care management is provided as the only service, hospitals are permitted to report an outpatient visit code of 99211 in addition to the 97602. And these codes would be reported per session regardless of how many areas were treated. So I'm going to stop there and we're going to go to part 2.